This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about what happens if your shoulder labral tear goes untreated. So it depends on the type of labral tear you have. So to understand labral tears, so what is a shoulder labrum? So your shoulder is like a golf ball on a golf tee. Your hip is more like ball and socket, a lot of coverage. Shoulder not so much, like more like a golf ball on a golf tee. And to keep that golf ball on the golf tee, you have something called the labrum, which goes all around. If you were to picture an actual golf ball on a golf tee, it would be like a bumper that goes all around the tee. It's kind of this like cartilaginous, kind of like a kind of rubbery layer, and that just keeps the shoulder in place. And it goes around 360 degrees all around the shoulder socket, which again is more like a golf tee. So it's divided into three parts. There is a front part, we call it anterior labrum. There's a back part, we call it posterior labrum, and there's a top part we call superior labrum. That's how they chose to designate it. There's not like an inferior labrum. It's just either front, back, or top. So it depends what type of labral tear you have. So if you dislocate your shoulder, most people who dislocate it when the arm is kind of out and back. And what will happen is that the shoulder will pop out of the socket and it will tear the front part of that labrum. Now, if someone's older and dislocate their shoulder, they're more likely to tear the rotator cuff. But if you're younger and you dislocate it, you'll tear that labrum. So what can happen besides pain and having to get your shoulder back in place is that when that labrum's now torn, your shoulder is not as stable as it was anymore, and it may pop out quite regularly. So if that happens, it might be a good idea for you to get surgery. Usually it's reserved for people earlier on in life, such as like people in their 20s, that if they dislocate it once, they'll tend to dislocate it some more. As people get older, they stop doing those same sort of activities, so they can have a shoulder dislocation and anterior labral tear and just kind of live with it. But if your shoulder is popping out all the time, you probably want to get the labrum fixed, because if you don't, what will happen is as the shoulder keeps popping out, it'll kind of wear away on the front part of that bone and make the repair harder and cause you problems. So, but again, if you're older and you dislocated once and your shoulder doesn't hurt too bad, you can kind of just leave it alone and it'll just stay torn. And as long as it doesn't bother you and you don't do motions like this, you can live like that, fine. The top part of the shoulder, they'll call a slap tear, which is superior labrum anterior to posterior. That just means the top part of the labrum is torn. That doesn't cause any shoulder instability. Your shoulder's not going to pop out of the socket if you tear that. It's more of just a pain thing. So it just depends how painful it is. Most people, start with some therapy or a steroid injection that calms most of it down. If it's still bothering you, then sometimes they'll do surgery on it, although it's kind of controversial. Sometimes one of the biceps tendons attaches right to the superior labrum, so sometimes the surgery is just taking that biceps tendon off and either letting it fly or reattaching it somewhere else. You can honestly do either. And just kind of cleaning up that labrum. They do also repair, some orthopedic surgeons will repair the superior labrum. The problem is that in patients older than 40, that can cause a lot of shoulder stiffness and they don't do too well. So it's generally reserved for younger patients. And even then, sometimes if someone's a pitcher and they get the superior labrum repaired, they don't really like it that much as it stiffens up their shoulder and they can't quite get back to pitching. So superior labrum, more likely to leave alone, not if it's not really hurting you. It's not going to cause any instability. Or if you need to get it taken care of surgically, you may want to think about just cleaning it and taking care of the biceps rather than reattaching it. The third part of the labrum, which is probably the part of the labrum that's torn the least, is the back part of the labrum, the posterior. Again, like the superior part, it's more of just a pain generator. It doesn't really contribute to any shoulder instability. It's a more uncommon tear. The types of people who will get it are like weightlifters or people like offensive linemen that do sort of blocking sort of motions can get it, or somebody involved in a car accident, or rarely if someone dislocates their shoulder backwards, like that's more like epilepsy or like electric shock or something, then they can get that labrum tear as well. Again, it's just a pain generator. If it's really hurting you, then you can get it repaired. If not, you can do some physical therapy and injections, and it may take care of mostly all your pain. So when it comes down to labrum tears, the only time I would say you really need to get it fixed is if it's really painful and if your shoulder is dislocating. That's when you want to think about it. Otherwise, if you just leave it alone, it's more or less a pain sort of thing. And if you can live with it, you'll probably be fine for a long period of time. I hope I was able to answer your questions about what happens if you leave a shoulder labral tear untreated. If you have any questions that I didn't answer, feel free to leave them below and I'll do my best to respond, although I can't respond about your specific medical situation. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.